slides. I want to welcome you to today's, very good. Who's controlling the slides? Okay, go to the first one. Thank you, that's okay. Today's webinar, which garnered quite a bit of interest, is a review of the Connecticut Office of the Healthcare Advocate. As I mentioned, I'm your moderator. I'm Evelyn Mantilla, and I work with the firm Grossman Hines. And we are really pleased to have Mr. Ted Doolittle, the state healthcare advocate, joining us today to be the main presenter in today's webinar. I'd like to tell you a little bit about Mr. Doolittle, if you don't mind. He has a long career in healthcare and law enforcement. He's a former federal prosecutor and has served as the Deputy Director of the Center for Program Integrity at Centers for Medicare and Medicaid Services, CMS for short. At CMS, he oversaw healthcare fraud investigations across the country. He has also helped lead the implementation of Affordable Care Act programs such as the Sunshine Act, Open Payments Program, which requires pharmaceutical and medical device manufacturers to report all payments to physicians. Ted has also served as the Associate General Counsel in the Legal and Regulatory Affairs Department at United Healthcare. And before that, he served as an Assistant Attorney General for Connecticut and a trial attorney for the U.S. Department of Justice. So as we move on with today's presentation, I'm going to hand it right over to Mr. Doolittle to give us a sense of the Office of Healthcare Access and to help us not just understand what the office does, but help us understand how we can best serve our clients through the Office of Healthcare Access. So welcome, thank you.
Thanks, Evelyn. I appreciate being here, and it's always a treat to talk about the Office of Healthcare Advocate. So what is the Office of the Healthcare Advocate? We're an independent state agency. What do I mean by independent? I am appointed by the governor, confirmed by the assembly, and we have an independent advisory board. So I'm not part of the governor's administration. Also important to note is that the healthcare advocate, the position that I've been in since February of last year, is a term position. So I have a 4-year term. So I will not turn over when the new governor turns over. I'll go into the new administration. The term can be renewed, but it does have to be renewed. So the idea was to give this office some independence from industry and from the state regulators, such as the insurance department. So what do? We do a number of things, but the thing that's most important to draw to your attention today is that we provide free expert assistance to any consumer that's got questions about their health insurance or plan selection. And in particular, our bread and butter, probably 80% of our man hours at the Office of the Healthcare Advocate, where we have 19 folks on staff, is representing consumers in insurance denial. So somebody has had their insurance company refuse coverage or say that a service is not medically necessary. If you go down in the explanation of benefits far enough into the fine print, you will find our name and address and contact information there. That's where we get a lot of our cases, not all of our cases, but a lot. In addition to that bread and butter, very important, most important work representing the consumers who have had health insurance denials, we do act as the voice for the health insurance consumer on policy with the government, with industry, and other stakeholders. We assist and educate consumers when selecting a health plan. I will say that we probably don't do as much of this work as it was probably envisioned when this office was first created in 2005, but we do sometimes help consumers who are in the midst of plan selection. That can be somebody who's choosing between employer plans. We do have a steady diet of folks that are on the exchange, and I'll talk a little bit about that partnership in a moment. Certainly the Access Health is the first stop for any problems there, but we do provide some backup in some areas that I'll mention in a moment. We educate the consumers on their health insurance rights and how to advocate on their own behalf. If we're not going to represent them, we'll set it up perhaps as what we call a coaching case, and tell them what they can do on their own, or perhaps they just need some education as to how to understand and maximize their own benefit. And then, as I mentioned, we help consumers appealing the health plan's denials. If they fill out the appropriate paperwork and give us the right permissions, we can represent them just the way an attorney represents you. We have a staff, as I said, of 19. That includes attorneys, paralegals, nurses, consumer information representatives, and other professionals that help the consumers. Our scope is that we help any Connecticut resident who requests our help. There does have to be a Connecticut nexus. Typically, the person lives in Connecticut. The plans are sometimes written in Connecticut, but they don't have to be. If you work for, a United Health Group, let's say, you're a United Health Group employee, your coverage is probably coming out of Minnesota, that's fine. We will work with a Minnesota plan when there's Connecticut involvement, like the residents here. State residents who are seeking care in other jurisdictions can also, we can also assist there. Most of our cases involve Connecticut, people located in Connecticut seeking care in Connecticut. We handle all types of insurance. As I say, if you give us permission, which is contemplated under self-funded as well as fully insured plans, if you give us the right permissions, we can act as your advocate within the insurance company's administrative procedures, and then out to the external appeal with the insurance department. We also assist with Medicare and Medicaid, known in this state, of course, as Husky. We don't discriminate between exchange and non-exchange, so we handle the full gamut of any type of health insurance issue. It also expands beyond just medical. So if you have a dental or some other even type of health coverage that you're having problems with, we can handle those cases too. Most of our cases are, of course, in the medical arena. And we're busy. We got in 2017, we got 6,000 calls or complaints or emails. And we saved consumers who called, those 6,000 consumers, we saved about $10.2 million. And so that's savings of close to $1,700 per consumer call, which is a pretty good return on the Connecticut's money. It's important, I should just drop a footnote here. We are part, for administrative purposes only, I don't report to anybody, but for administrative purposes, in terms of our HR and our IT support, we're part of the insurance department. We're also part of the insurance department budget. That's important to note because that is not funded out of the general revenue. That's funded by an assessment on any type of insurer, be it casualty or health or whatever. Anybody who wants to sell insurance has to pay what they call an assessment. So it's actually been good for us because it's given us a little bit of insulation, not total insulation from the budget woes that Connecticut is under, but a little bit of insulation because it's not in the general revenue. But $1,700 per call is pretty good, I think. We calculate those savings carefully, and to share just the basic algorithm, we have a whole handbook on how to guide this. But if somebody comes to us and coverage has been declined, let's say, and they have a $5,000 bill, and we get the company to agree to pay that $5,000 bill, agree that it's covered, but there's a $1,000 deductible, we would say that we saved that consumer $4,000. They walked in owing $5,000, they wound up having to pay $1,000, we saved $4,000 for that consumer. That's roughly how we calculate it. Just an example of a recent case. This was a complicated one that we handled for a complex youth, disabled youth who was living with his family. He needed a specialty communication device. The carrier said it wasn't medically necessary, and we worked with the providers. We worked closely with the providers to gather information and records, and worked with the insurance company to demonstrate that it was, in fact, medically necessary, and JJ did receive his specialty communication device. And that was a savings of about $6,000 to JJ's family. This is a little bit of an unusual case, but it just added in here to demonstrate that we do handle all kinds of insurance cases, not just major medical. This involved a foreign exchange student who had a short-term plan, ran into some serious medical complications while he was over here, and the carrier determined that it was a pre-existing conditions exclusion, since this was a short-term plan, of which has been much in the news lately. So hopefully we won't get too many more of these cases, but we are bracing for getting more of these cases. We were able to help the host family after they had unsuccessfully appealed and got the coverage for this foreign exchange student. As the cases come in, our managers triage just the same way an ER might triage. They triage for acute cases. They have to stay on top of who's got what cases and who also on the staff has what vacation or other personal considerations coming up to get the case to the right place. But they also are examining and data mining to a certain extent to look for new issues as they pop up. And I just give an example of recently there was a major hospital system in the state that employed a new billing vendor, and they were processing certain types of claims incorrectly. We were able to pick that up and then not just solve those cases, but in fact go out to the provider and work. We have great relationships with a lot of providers across the state. Got a meeting with the billing folks, explaining the situation. They agreed with us, and now those cases have gone away. So it's important to constantly scan your incoming cases, and we do that. We also, as I mentioned, we try to keep our watch out for the best interest of the consumer at all times. Last summer, you may recall, the contract outage between Anthem and Hartford Healthcare. It caused a lot of consternation, caused a lot of calls to our office, people who woke up, especially in the northeast corner of the state where all the hospital systems have been taken over by Hartford Healthcare. They woke up one day with their Anthem card really not valid. They would have to drive to Hartford or further, to St. Francis to get care. We work closely, and I do credit Anthem and Hartford Healthcare, in fact, for sharing information with us very openly. They shared their notices with us. We could tell from the number of calls that were coming in that there were some gaps in those notices. We were able to work with both the providers and carriers to get more training and to make some adjustments and to send out, in some cases, additional clarifying letters. So this is the kind of thing that we can do just as a watchful eye on the industry. I do mention there in the last bullet that we did editorialize on that. We also testified in the General Assembly, and we pushed reform legislation, a version which in fact was passed into law. We do have some additional authorities I just wanted to let you know about. Under a 2015 agreement with the insurance department, we can request insurance carrier rate hearings for premium increases over 10%. We haven't done that, and we are right in the middle of the rate season, as many of you know right now, and we're assessing our options there. We also, our statute does give us the authority to promulgate regulations. We have not invoked that power at this point, but we do have authority to promulgate regulations. That would have to be, I think, very narrowly tailored to our statutory mandate, which is consumer education around health insurance, managed care plans. So we also have constantly we're doing outreach. We go to hundreds of events per year. And I just wanted to share a little bit about an initiative that took place last fall and early this year called Connecticut Speaks Out on Healthcare Costs. The offices of the Healthcare Advocate, even though we're helping consumers negotiate their individual insurance issues, we also have a strong belief that the healthcare system in our country is first too complicated, but secondly too costly. And I don't need to remind folks that we pay twice as much for perhaps equal quality healthcare as the other advanced nations. So to gather information about that, we launched a series of 6 listening sessions around the state where we asked people to come forward with their own stories and anecdotes about the challenges of affording healthcare. Was it the premium? Was it the copay? Was it something else? To what extent are you adjusting behaviors like cutting medicines in half? You know, how are people trying to survive the high cost of healthcare out there? And we had a good session in a lot of areas around the state. And we asked the participants to fill out surveys, 3 surveys, one on affordability healthcare, one asking for their input on potential solutions, and one just to tell the story. And we videotaped and transcribed those. And we are currently in the midst of finalizing a report for use with the new legislature and with the new governor when that occurs in January of next year. But that's always important to keep your eye on the overall scheme. And in addition to the trench warfare of fighting on a case-by-case basis, OHA tries to keep its eye on the larger policy picture. And certainly I think that if we could get healthcare costs down, many of the complaints and difficulties that everybody has with the healthcare system would get better. So that's a little bit about Connecticut Speaks Out on Healthcare Costs. I mentioned that that we work on legislation and policy. We have a lot of partners that we work with. Prominent among them is the Universal Healthcare Foundation of Connecticut, certainly the community health centers, and many others that we partner with and work with actively. We track legislation of relevance to consumers in the state. We very commonly testify in person or file written testimony, and this is just a little summary of the work there. That work is primarily engaged by myself and 2 of our attorneys. I mentioned a little bit about this. We have community collaborations. We've been active in the Choosing Wisely movement over the past couple of years, and others. There's always a staff member going out to a group or a council meeting, and we try to stay aware of those activities and help out where we can there. I think that is just a list of some of the boards we sit on or other partnerships that we participate in. Very important on the horizon, in my view, is the All Payer Claims Database that's was temporarily housed actually in Access Health. I believe it's over at Office of Health Strategy, if I'm not mistaken, but I'm very high on that and think that it's really going to be good for this state to have a database that goes back to 2012 that includes all the commercial, all the public claims in the state, including now Medicaid. So I'm really looking forward to that coming online and becoming useful. I'll just mention the Behavioral Health Partnership. We have in our we had legislation that mandated us to set up a essentially provider database to keep track of what mental health providers were out there, what behavioral health providers were out there, which plans they are in network with, and be a resource for people to find care, behavioral health care. That is a great project, but it was not funded by the legislature. So that one, we're still trying to figure out how to get that off the ground. We have big plans there, but the legislature gave us a mandate that was not funded, so we haven't been able to execute too much on that. But we're also very active in the governor's healthcare cabinet and a bunch of other partnerships. I think that is pretty much the slides. Is there another slide? I could be wrong. Yeah. I think that's an overview. Try to give you an overview there, Evelyn, of our activities and what we might, how we might be relevant to the brokers and the others who are on the call.
Terrific. I really appreciate that information. I think that, Access Health Connecticut, partnering with offices such as yours, the Office of the Healthcare Advocate, can really get the information out to our partners. And if I could take a moment, I'd like to speak now about the partners that work with Access Health Connecticut. We are always looking for opportunities to partner with groups and organizations that can become our community partners. And here you have, for example, a few of the samples of the types of organizations that Access Health Connecticut is always looking to do outreach with and to partner to not just get the information out to the clients of all of our community partners, but to also educate folks and have some mobilization of what needs to happen in order to continue to lower the rate of the uninsured here in Connecticut. We have community health centers, community organizations. We work with the Department of Labor. I won't go through all of them, but health departments, libraries, faith organizations. And I'd like to point out the fact that Access Health Connecticut does a terrific job at looking to get further and further into each community in the state of Connecticut by getting closer to the neighborhoods, the locations, and going to where our clients are. So that's what a community partner is all about. Here's a wonderful map that I like to show that is actually probably even a little bit more crowded now. This is a map across Connecticut of where we have been able to establish community partnerships. So as you can see, we're trying very hard to go across the entire state of Connecticut. Partner engagement. Here are some ways in which a community partner, can be, how we can be helpful to you. Access Health staff can speak at events. We provide informational training sessions. We are able to table at your events or events in your community. We host educational webinars such as this one for our partners. And we, of course, have the Access Health Connecticut community website. And I'm always talking about this website because I really believe that it's a treasure trove of information that is really useful to not just our direct partners, but to anyone who wants to see closer how much Access Health Connecticut is doing to reach across the state. So I encourage you, if you haven't had a chance to yet, go to the website learn.accesshealthct.com/community. In that website, you will be able to see, for example, the recordings of webinars such as today's. You will also see a calendar of where Access Health Connecticut is across the state in different events. You can see printable educational materials that you can pull right down and use for your clients. And of course, we can provide materials that you can distribute to your communities. Some ways that you can help us spread the word are, for example, placing a poster somewhere that your members can see very well. You can display open enrollment brochures. You can send emails to your membership, and you can link us to your website or social media posts as well. So those are some of the things that community partners continue to do. A reminder of what we can provide. Speaking engagements. We will go out to your organization and provide speaking engagements in English and Spanish. We also attend local state events like fairs, festivals. We provide educational webinars like today. We provide informational materials, research and surveys, and of course, we do hold planning sessions every year across the state of Connecticut so that you as a community partner are able to have a voice in how we do business. some of the resources that we'd like to point out to. I already mentioned the community website, but I'll mention it again because I think it is that helpful. Please go to learn.accesshealthct.com/community. Check out the website. It's a treasure trove of information. In order for you to help your clients search for in-person help, you can also go to support.accesshealthct.com. I hope that everyone on today's webinar is looking forward to the community newsletter. If you are not signed up to receive our monthly newsletter, it is really interesting and helps you stay up to date on everything that we're doing. So sign up today. And of course, the webinars such as the one that we have today. Encourage you to contact us. One of the best ways to do it is to reach out directly to the outreach team at Access Health Connecticut by emailing outreach@accesshealthct.com. And as you can see in our community website, you will also see all of the other different ways to contact us. Don't want to forget to mention the 2018 Community Conference. It is already scheduled for Friday, October 19th. It will be held at the Red Lion Hotel in Cromwell, which is essentially the same hotel, but we've had it before. Do RSVP at the link that you see on this slide. This year's conference, again, is promising to bring terrific speakers, great panels, and a lot of information that we are very proud to share with our community partners. So save the date, October 19th for the 2018 Community Conference. And if you are on this webinar and you have yet to become a community partner, reach out to us. I mentioned the outreach email already, outreach@accesshealthct.com, but you can also call us directly. And by directly, I mean that you reach the outreach team specifically at 860-327-5517. For the third time, and never can mention it enough times, the Access Health Connecticut's community website. And of course, don't forget to follow Access Health CT in all of your social media. We will follow you back. So with that, we're happy to have any questions that individuals are able to share. And yes.
Could I just add something before we go to the questions? I promised to mention a little bit more depth the partnership that my office has with
terrific.
Access Health. So let me just say a few words before we go to the questions. So we have one of our staffers who really is dedicated to Access Health and Husky issues. He does other things as well, but he's very good, and he works closely with one of our managers. And I did want to stress that we're not the primary place to go, or the first place to go, if you have an enrollment issue or an income or eligibility issue or anything of that nature. You should first go to AHCT, Access Health, and work with them. When clients do become stuck and they get caught in a loop, that's probably the best time to come to our to OHA. You should, for these types of issues, I would think of OHA as a backstop and a safety valve. We're always eager to help, but we don't want to take away from the primary route that people should really be using. I should also say that appreciated your words about the outreach. We also do active outreach and would be happy to partner with anybody out there. We have a whole list of annual events that we go to, but we're always looking to add new partners in that regard as well.
Terrific, terrific. So we identify with each other's work in many, many ways, certainly more ways than one. So again, before we go to questions, and I'll take a quick opportunity and point out the chat box. If you look at the chat box that we are showing you as part of this webinar today, you can go right to the links for the community newsletter. If you're not signed up, please do so. And of course, you can register by the link that we have posted to the community conference. So don't miss out. Save the date and be part of the community conference. Now, let's go to some questions. If anyone has a question that they would like to post right now, type it into the chat box and we will answer it. We have, however, also received some questions ahead of time from some of the participants to sign up. So if I can go ahead and let's ask you a couple of these. First of all, is there a waiting list at OHA? How is the flow of the cases coming through?
So there's not a waiting list. We take, most of our outreach comes through calls, although you can easily email us at the email on the screen, healthcare.advocate@ctt.gov. That's probably the very best way if you have a complaint to reach to us. But the calls come in to the number on the screen, that is actually my direct number. The number to call to try to get a case into the queue would end in 0 instead of 1. So it's 860-331-2440. That's 860-331-2440. But the cases come in. If we are able to answer them in person, we will, but of course with 6,000 per year, that's not always possible. Most folks who call us do go into a voicemail. We have a commitment, which we strive to meet. We don't always meet, but we have a commitment to answer the phone call or the email within 24 hours. The vast majority of them we do answer within the first day. So you've established that contact at least during the first day. But usually, as I say, I would have to say almost invariably, although not invariably, because folks do fall through the cracks. Within 24 hours, you will come back. 24 hours, you will hear back from us.
Terrific. Excellent. And we have a question coming in from one of our participants. It reads as follows. I am curious as to your thoughts, any information you may have on the new rule from CMS rule regarding the availability of short-term low-cost insurance plans that will be going into effect in the next couple of months.
Yeah, so the participant is referring to the new rule. I believe it was just came out early last week or late the week before, the short-term limited duration plans, which currently exist. They've existed for a long time. Right now, it's limited to 3 months. Now, these plans are not compliant with the ACA. They can exclude you for pre-existing conditions. For instance, we saw an example of that in the case study about XC that I referred to before. They also might not have all the essential health benefits. They also might have an annual limit or a lifetime limit. They could exclude certain types of coverage. Perhaps cancer might not be covered or maternity might not be covered. They were meant to be a stopgap under the original interpretation. The new rule that just was finalized allows plans to be sold. The initial policy can be anything short of 12 months. So 364 days you could sell the policy for, and under the new rule, it's allowed to be renewed up to 36 months. So it's becoming much less of a stopgap, much less of a between things type of plan. The concern is that these plans will be cheap because they are allowed to underwrite. They're allowed to screen out and not sell it to you if you're not healthy. So you can provide insurance cheaply if you only have healthy people. And the concern is that the healthy people that go this route to save money on premiums are going to have that many fewer healthy people in the risk pool on the exchange. So we're very concerned about this. I will note that the rule was very interesting to me in that I would say 15 times in that rule, which is a couple hundred pages, I would say 15 times or more, CMS, the Centers for Medicare and Medicaid Services that promulgated the rule, went out of their way to remind the states that the states could have stricter regulations. For instance, the states don't have to allow 364-day policy term. They can keep it at 3 months if they want to. The states could put in essential health benefits listed and covered. So there's an opportunity for states to protect their citizens if they deem it to be necessary. already in several states, at least to New York and New Jersey, these short-term plans aren't even allowed in the first place. So the rule won't have any effect there because it's not allowed there. They are allowed here. I'm not sure how much uptake we've had in this state, but it's something that I'm very concerned about. Here's one thing I will say, and this is where the Office of the Healthcare Advocate really feels like we need to get engaged on this issue. If we move forward with some version of the plan that's much more lenient than the current rule, and that it will be up primarily to the insurance department in the state, which is the primary regulator, we need to make sure that we have a really strong disclosure and notice regimen so that anybody who buys this plan, this type of plan, is aware of those limitations. I want to avoid in a year and a half sitting here and telling you about a consumer that called up my office, said, hey, I thought I was covered. I didn't know I had a $20,000 annual limit on my benefits. I want that consumer, if they bought the plan, to be very well aware that it had a $20,000 limit. So that's really the focus that we're going to be working with at OHA to try to make sure that to the extent limited plans are allowed in the state, the consumer understands what they're buying.
Terrific. Thank you. Thank you. I really appreciate that answer. Let me ask you another one of the questions that were posed to us before. Does OHA serve employers? And if so, how?
Yeah, we do. I would say, and we often, in a self-funded plan, of course, we will work directly with the employers. Let me give you one example. Recently, there was a Fortune 100 company, and one of their employees living in Connecticut came to us, and it had to do with in vitro fertilization, and in particular coverage for the use of a surrogate mother. And the major insurance plan that was administering this benefit stated that they didn't feel that it was covered. We actually agreed when we read the policy, but we went, as this was self-funded plan, obviously I think probably every Fortune 100 company is probably self-funded by now, but we went directly to the employer, made sure that the benefits administrators knew how this plan was being administered. They realized that the company wasn't comfortable with that, and they wound up not only covering our client, but changing the policy for hundreds of thousands of employees worldwide. So that's an unusual example of how we work with employers, but certainly that gives you an idea of how it can be as important to work with the employer as with the carriers sometimes.
Great, thank you. How about working with multicultural and multilingual communities? What provisions has OHA made to be able to communicate and serve those communities?
So we have several standard brochures that we have in many languages, and by many I mean like 30 languages. So if you have a language out there you'd like to try us on, we might be able to help you. We have Albanian, we have Lao, I believe. We have a lot of languages, in addition, of course, to Spanish. Mm-hmm. We have many more resources in Spanish. We also have two fluent Spanish speakers on staff, and so we're able to handle that bilingual community. That's not everybody who's bilingual, of course, mm-hmm. but we're able to handle them quite nicely.
All right, terrific. I have one more question that I think we have some time for. This is wanting to confirm that we have the right phone number to reach you with. Does the Office of the Healthcare Advocate still use the toll-free number 866-466-4446?
We do use 866-466-4446. And I should have put that on the slide.
Okay.
My apologies for that. That's still very valid. Healthcare.advocate@ct.gov is our email, but either the 866 number is our best phone number.
Okay, terrific. And leaving a voicemail at that number will result in the call back and so forth.
Exactly.
Terrific. Okay, excellent. All right, I want to remind everyone that if you have any other questions, you can still have a moment to type it into the chat box for us. In a moment, we are also going to put up on the chat box one more link, and that link is for a piece that is very important to us, a survey that we would like for you to take just a minute to complete. And the survey is up. If you can see it from the Grossman Hines posted, take a moment to fill out the quick survey here from SurveyMonkey and tell us how you felt that today's webinar went. Your feedback is very important to Access Health Connecticut. We're continually trying to improve and provide the best possible information for our folks. And so I ask you, no, you know what? I'm going to beg you to give us a chance to hear the good and the bad about the usability of our webinars so that we can continue to work to provide you the best product possible. That is really all I have for questions, unless if you want to have a minute for some closing remarks, another perhaps another plug for the important work of the Office of the Healthcare Advocate, and I think encouraging people to take advantage of the great resource that it is.
Yeah, I think it's really the best kept secret in state government. I mean, anytime I'm in front of 10 or 12 people and I explain what we do, I see the eyes light up, and it is directly relevant to, you know, you wish you knew about us 18 months ago when you were having this problem with Johnny's broken arm, or your mother currently is having a problem. And I would say, Evelyn, anytime I'm in an audience of 15 or more, we get a case. We get a case from that. That's how pervasive the need is. It's great that we're on the explanation of benefits, but we're constantly looking for ways within our limited resources to get word out about really one of the best kept secrets in state government.
Great, terrific. Well, let me take a personal moment and thank you, Mr. Doolittle, for the great information that you helped us distribute to our community partners today. I want to also take a moment and thank everyone who participated in today's webinar. Access Health Connecticut really appreciates the fact that you will take the time to listen to what we have to say and be part of the conversation that we as the outreach team for Access Health Connecticut are always working on. So with that, I'm going to encourage you one more time. Take that minute and click on the SurveyMonkey link. Tell us what you thought of today's webinar. Give us any suggestions at all. And don't forget that you can go to the famous website, the learn.accesshealthct.com/community. It will help you get to us, get information to us, and also partake in all of the information that we are constantly trying to publish out to our community partners. So with that, I'll say thank you to everyone. Close today's webinar, and we look forward to having you over again for perhaps an even more in-depth look at this important work. All right, thank you very much. And with that, I will close the meeting. Thank you.